my name is Natalie Turvey and I am Director and Principal Psychologist at Drop of Life Psychology Clinic on the Gold Coast, Australia. And I'm doing a series of anxiety related videos, and today is my fourth one, and today will be on social phobias or anxiety, whichever one you want to call it. So today we're going to be talking a little bit about the fear that is gained from social situations, and it's a little bit more than the normal anxiety that you would get from being involved or going into a social situation. We all receive a little bit of that, but social phobia or social anxiety disorder is the real fear of being scrutinized and judged by others, to the point where we actually avoid that situation, that you will not want to go into that situation. You're concerned about looking a fool in a conversation. You're concerned about meeting new people. You're concerned about people watching you eat, performing, work performance, everything. And it's to a point where it's the fear of evaluation of being judged, but it's to a point where you feel like it's humiliating. You will be humiliated, you will be embarrassed, and you might be embarrassed of sweating too much. You might be embarrassed of if you blush, of stumbling over your words like I occasionally do with these videos. So it's that fear, and it's that fear that's actually going to stop you doing what you should probably do in a normal situation. And it's also, like all of the anxiety diagnosis, it's out of proportion. It's out of proportion with the actual threat that is there. So it's the person over evaluating the negative consequences that are going to come out of that situation. So I'm once again going to put the selection, I keep saying selection criteria, it's diagnostic criteria on the side here. And what we need is for there to be at least 6 months or more of things occurring over here in that diagnostic criteria. And it does, once again, look, like always, look a little bit different with children and with teenagers, because it has to involve their peers when it's got to do with young children. And because avoidance is a little bit different in children, it looks a little bit different. So we're noticing different things like tantrums and clinginess and things like that in younger children. So be aware that this particular diagnostic criteria also has a little element in there about the way people avoid. Often because we're in social situations, avoidance can be used by alcohol and other substances to take away some of the physiology. And so that then it also ends up being a diagnostic criteria of having alcohol and other substances involved in it. So the prevalence, we see about 7% of the population, roughly, with this type of condition. So it actually is quite common. We do see a lot of it in sessions at Drop of Life. It would probably be one of the biggest things that I see. That and generalized anxiety disorder, which is a few videos to come. So, you know, the onset really starts to occur, what I've seen and what the DSM tells us, is from 13 onwards. And it's sort of roughly, the age range is from 8 to about 15, but we kind of really see a lot of it occurring around the 13 years of age. And I certainly do see a big spike in presentations at the clinic around that age as well. And there's probably a variety of reasons for that, which I won't go into today. So their obvious concerns are being observed in class, and they will sort of be very nervous about presenting in class, which also impacts on their academic ability as well, because a lot of the times they won't be able to finish assessment, because now a lot of assessment is done through presenting to the class. So it ends up impairing their academic performance as well. So without treatment, I find if children don't come to treatment to get some help with this, just some little strategies even on how to manage the anxiety that comes and the overwhelm that occurs, we do start to see that there's an increase in school dropout, an increase in well-being, a decrease in well-being, I should say. We see that, if it continues into your adulthood, we see that, you'll turn up opportunities in employment, your work quality will go down, your performance at work, and also we'll see things like your quality of life is just a little bit poor because of not being able to engage in normal things that most of the population are taking for granted. So it does end up playing a huge part. I just do want to touch on shyness because I have a lot of children that come to see me and they're shy individuals, and that's a personality trait. But it doesn't lead to, it's not a diagnostic criteria for social disorder. So it's not pathological, it's a trait that you see. So you're a little bit more prone to finding it difficult to engage in social situations, but it's not meeting all the criteria over here on the right hand side. And just because we're going to talk a little bit about later in another video about agoraphobia, and there's a big difference between, well, there's a lot of things that cross over, but between agoraphobia and social phobia disorders, because agoraphobia is more about the concern that, which we'll talk about later, which is more about the concern that you're going to have a panic attack, you're going to be incapacitated in a social situation, whereas the social disorder or the social phobia is more about the scrutiny of others, is more about being judged or humiliated by others. So there's a bit of a difference between the two. One's about your physiology taking over, and one's about being judged by others, basically. We often do see, just on a note with that too, we often do see other things occurring at the same time as social disorders, such as depression. There's a high rate of people with social phobias and depression at the same time. Also things like substance abuse, as mentioned before. So that, it does start to impact a lot more on your life than just not wanting to go out and be in a social situation. It is hindering your life, and it's stopping you enjoying and having a quality of life that everybody deserves. So if this is something that you struggle with, then please do go and get some help for it, because it is something that can be treated. You can get strategies to help you manage this and help you manage it well. So I hope you enjoyed this short video today. If you did, please leave a note. I'd love to know some feedback. But remember today and tomorrow to be kinder to yourself than anybody else can be. Thank you.